Hello, everybody. Welcome back to the Beat Podcast. So excited that you tuned in again. Today, I have the privilege of hosting Nikhil Buduma. He's the co-founder and CEO of Ambience Health. He leads the end-to-end R&D lifecycle of Ambience Healthcare's AI platform for documentation, coding, and clinical workflows. Excited to host him here on the podcast. Nikhil, thanks for joining.
Thank you for having me.
Of course. So how is the health conference treating you?
It's quite the zoo. I remember being here 3 years ago and there was barely any conversations around AI. And now you can't walk 5 steps without seeing something AI related. I think every company now is an AI company. So the world has been changing very rapidly.
It definitely has. So tell me a little bit more about your role at Ambience.
Yeah, so I'm the CEO of the company. Started the company in 2020 with my co-founder, Mike. Mike and I have actually been building together for about 11 years now, all at the intersection of AI and healthcare. We both have our own stories coming into healthcare. This is a very personal journey for the both of us, but before starting Ambience, we actually ran our own care delivery organization. So we hired clinicians, we implemented an EHR, we actually worked with payers. And so we learned a lot about what it feels like to be an operator of a health system. And we tried to build technology for our clinicians. And so we firsthand learned all the challenges that come with trying to get technology adopted into the workflow. In many ways, everything we're building here at Ambience is to solve many of the problems that we faced ourselves about 5 to 10 years ago.
That's great, man. I really appreciate that. Nikhil, that's really interesting. So you really went from being in the trenches, building it, to seeing the needs firsthand, to building a solution for those needs.
That's right. I think when we started the company, a big part of how we approached the problem was understanding how clinicians were currently spending time at the point of care. What percentage of a time a clinician actually spends hand-on patient during their day?
20%?
Yeah, it's like 27%.
Okay, I figured it was low. Right?
It is low. And you think about everything else they're expected to do. Search through the EHR, go through the scavenger hunt to find information. They're writing documentation. They're navigating these tens of thousands of coding and billing rules that are different by payer, that change year over year. None of this they went to medical school for. And so we're in this weird world where technology has actually removed the joy out of the practice of medicine. And so a big part of how we thought about building technology was, how do we holistically liberate clinicians from this administrative burden? I think what's very challenging for us and the customers that we serve is we work with some of the largest academic medical centers and most complex health systems in the country. And so you think about the job of a primary care physician versus the job of an oncologist versus the job of a hospitalist, how different the medicine is, how different their workflows are inside of Epic or the EHR that they're using, how different the coding and billing workflows are. And if you want to serve these customers, what you realize very quickly is you're not building one product, you're building over 100 different products to address all of the workflow in all of these care settings. And so I think that we learned firsthand from our own experiences operating.
Yeah, it's definitely complex and a lot of layers. And ROI is becoming a key conversation point, especially around AI, since there's so many solutions. What are you seeing with your deployments?
Yeah. The way we think about it is, first and foremost, you got to get the basics right. Everyone's trying to build a whole host of features. And yet, despite all the excitement around AI and ambient listening, if you walk into a health system today and you ask, what percentage of your doctors actually use AI in the workflow? And what percentage of visits do they actually use it for? What we find is that the answer is quite disappointing. More often than not, despite the fact that they're paying for all of these licenses, only about 30% of doctors, usually in the simplest parts of the health system, primary care, family medicine, internal medicine, are actually using the technology. And in the specialty areas, the adoption rates can be as low as only 10, 15, 20% of their visits are actually being processed by AI. And so you have to get that foundation right to even have a conversation around ROI. But once you do, and I think we've done a good job of that, you go to a place like Cleveland Clinic, 80% of all of their clinicians use Ambience every single day in clinic. 70% of all scheduled visits at Cleveland Clinic are processed by Ambience. Once you get to that kind of scale and you've earned the right to be part of every single visit, that's when you can have the conversation around ROI. And the way that we think about it is there's all of these reasons why revenue cycle goes wrong. something that causes a CDI query, something that causes a denial. How do we take all of the intelligence of those teams and bring them up to the point of care so we make it easy for clinicians to do the right thing in the workflow as early as possible? How do you pick the right ICD-10 codes? How do you pick the right CPT codes? How do you close gaps in documentation to support those codes so we can preempt all the reasons why denial might have happened downstream? And what we're finding is if you can use the privilege of being in the workflow to solve this revenue integrity problem, there's on the order of tens of millions of dollars of lost reimbursement for work that clinicians are already doing, but they're not getting credit for. And we're finding that's the key to the CFO's heart. And it's amazing for the rest of the clinical and IT teams because it creates the halo effect for other AI projects in the future because you've all this funding now to invest more in technology to better the clinical experience.
That's great. And so are you guys focused on really from encounter to delivery billing? Yes?
Yeah.
Is that just, yeah, is it?
Look,
So
the way we think about it is if you want to service, take an oncologist, for example. The burden for an oncologist starts before the visit even begins. You think about their visit burden, about 70% of an oncologist's visits are follow-up visits. To actually prepare for a follow-up visit, they're going through past notes, they're going through labs, they're going through pathology. And in fact, they can write 80% of the documentation before they step into the room. And so if you've got one system doing pre-charting and a different system doing ambient listening, you've got a broken workflow because you've got to combine two summaries together to produce documentation. So in many ways, for us to even earn the right to solve the problem for the oncologist, we have to solve all those problems across the entire workflow. The same can be said of coding and billing, because documentation is not just for the clinician, it's also for all the downstream stakeholders. So we work with an organization called St. Luke's in Boise, Idaho. They are an integrated delivery network where they have a ton of Medicare Advantage and a ton of covered lives. If as a primary care clinician, you write documentation, but you've picked the wrong ICD-10 codes because you are mapping to V24 and not to V28. And then you wrote documentation for yourself, but you didn't recognize that the payers are looking for specific things in the assessment and plan to support those HCC codes. Then all of a sudden you might have solved a front-end problem for the clinician, but someone's chasing them down a week later to try to rewrite this note afterwards. You might look like you're solving a problem, but you're actually creating more work downstream. Turns out, if you don't solve these two problems together, because documentation and coding and billing are two sides of the same coin, you can actually create more problems than you solve for. But the upside case is, you can imagine, clinicians didn't go to school to write documentation. They sure as hell didn't go to school to learn the coding and billing rules. And so the opportunity to make doing the right thing easy, to make doing the right thing obvious at the point of care means that organizations actually see a significant improvement in both their financial sustainability, but also their compliance posture by actually closing the accuracy gap.
Yeah, no, that's super interesting. And definitely those little nuances, the ripple effect of one thing, what it could do to the entire process could be very damaging if not done with the entire picture and an integrated approach in mind. Increasingly, health systems are saying ambient AI is helpful, but they're running into compliance issues with AI-generated documentation. How does Ambience approach safety, accuracy, and compliance?
In some ways, it's funny because when Mike and I first started the company in 2020, our seed round deck said that we were going to use AI to solve documentation and solve coding together. And we were laughed out of most rooms at that point in time. And the reason is VCs would say there are entire companies that have raised tens of millions of dollars to solve scribing with AI. There's a similar number of companies in the graveyard that have tried to raise money to solve AI for coding. And you're saying you're going to do both. But the reason we chose to do that was if you don't solve those two problems together in concert, and there's contradictions between the codes you select and the documentation you write, you do cause and create a compliance problem. And what makes this problem even harder is if you look at all the frontier reasoning models being produced by OpenAI and Anthropic, they're extremely poor at navigating the complexities of revenue cycle, coding and billing, and documentation integrity. And so we spend a lot of time as a team deeply understanding those administrative rules and making sure we have created models that can do this as accurately as possible. And when we work with an organization, We think of this as such an important part of the work that we do that we actually pay for third-party auditors to come in and continuously monitor the shared work that we're doing together to make sure that organizations we work with feel really confident in their compliance posture. So we'll actually pay for the APC, which is the professional body on coding, to come in and actually give us sort of the stamp of approval that what we're doing is accurate and compliant, and continue to refresh that on a monthly or quarterly basis.
Well, that's fantastic. Definitely speaks to your commitment to accuracy and compliance. And it's interesting to hear that story about getting laughed out of rooms. I'm sure that was discouraging, but you've stuck to your guns and have proved the thesis. These two are related. And if you work with them together, you're able to actually solve bigger problems.
Yeah.
So looking ahead to the next 3 to 5 years, what bold bet is Ambience making that you believe will truly transform the healthcare experience?
I think there's probably a few things that are big bets for us, but perhaps one of the most exciting that we're interested in is the opportunity to inject more clinical intelligence at the point of care. Earlier this year, we actually launched a product called Patient Summary. And what it does is, before you walk into the room, anticipates the questions that you're about to ask, the data that you would need for the decisions you're about to make, and creates almost this bespoke dashboard for the specialist. It's almost as if you had a clone of yourself with infinite time pouring through the EHR to prep you for this visit. Now, as you can imagine, we're really good at anticipating many of these questions, but there are also some questions we just don't necessarily anticipate. And so clinicians asked us, is it possible for you to almost create a ChatGPT type experience afterwards so I can continue to ask questions? We call this Chart Chat, and it has full access to the EHR, access to evidence-based guidelines, medical calculators. It can trend biomarkers over time. It can basically answer any question, even some of the most complex questions in the workflow within seconds. What we're excited about is what this looks like as these systems get smarter and smarter over time. Is it possible for us to start to take what you would consider standard of care at some of the best academic medical centers of the world and democratize that? So even if you're somebody who seeks care in rural Arkansas, that when you go drive 2 hours to see your primary care physician, that it feels like they've got the entire care team of Cleveland Clinic or Mayo Clinic at their side to help make better decisions. And I think this is important because you think about the folks born in rural America. They're 50% more likely to end up in the hospital for a preventable reason. Half of that increase of risk is due to lack of access to specialty expertise. And so I think that's a very exciting future where it doesn't matter where you live, doesn't matter your zip code, that you could have access to extremely high quality of care from the people that you trust in the community that you're close to.
Yeah, that's fantastic. Something to definitely look forward to. And on the topic of access and outcomes for historically underserved populations,
Yep.
What a great way to address that.
We think so too.
Well, listen, Nikhil, wow, you guys are up to some really great stuff. I really appreciate you coming here to the podcast and sharing all of what you're up to, or at least tip of the iceberg of what you're up to, of what we could do with the time we're allotted here. What's the best place people can reach out to you to learn more?
We're at ambiencehealthcare.com. Feel free to shoot us a note. I think we're just finding that this set of capabilities is evolving so quickly that it's going to require deep collaboration between folks like us, the people working on foundation models and health systems, to identify the most valuable problems to go solve, and then put together the right team with the right level of intentionality and resource and go solve them. And so excited to continue the conversation.
That's awesome, man. Thank you so much. And folks, in the show notes, you'll find how to get in touch with Nikhil Buduma, co-founder and CEO of Ambience Health. It's ambiencehealthcare.com, but just go to the show notes. You'll be able to click on it there and get in touch. Nikhil, this has been a pleasure.
Thank you for having me.